right. Well, welcome back. It's been a long time without Sleep TV. This is something we started during COVID, and it's been years since we really had it back live. And I wanted Dr. Kent Smith to be our first guest back here. We've got a lot to talk about. A lot has happened in the past handful of months in dental sleep medicine and with our APSME family of companies that I want to talk about. So. Yeah, this is awesome. I'm glad we had a few minutes here with Dr. Smith to catch up. Um, Kent, everybody knows you as like the sleep guy in dentistry. Um, but it was for those of you that don't know Dr. Smith, it wasn't always like that. When we first met, you had, gosh, I'm trying to remember, 21st Century Dental, I think it was, right? And that
Yeah,
was
yeah,
dental practice.
yeah.
So tell us about that, how it transitioned from a dental business to a sleep only practice.
Yeah, I mean, I started 21st Century Dental back in about 1998, and then just kind of grew it. We expanded, we moved. We eventually had 15 operatories and 8 hygienists, and it was a great dental practice. But then, I was always doing sleep as part of it, but I was still doing dentistry. And then eventually I realized how profitable sleep was and how fun sleep was. I said, you know what? I'm going to hand all my dental patients over to our associate that he just brought in. And then, I had been teaching sleep for a while. I started the LVI sleep program back in 2007. And so, I was teaching a lot. So it just kind of made sense to start going more and more sleep, and eventually became all sleep. And my income did a little bit of dip when I handed off every bit of the dentistry, but it wasn't long before it came up, and now it's far surpassed what I ever did in dentistry.
How long has it been now for 100% sleep?
About 16 years.
Oh, wow. Okay.
Yeah.
That's awesome. Um, you know, it's funny because I talk to a lot of people and it's always a goal, right? And a lot of the people that you and I know in dental sleep medicine and they're on that spectrum of transitioning, right? They're on their way there. They're 40% sleep and 60%, and everyone's trying to figure out when to really flip the switch and pull the plug. But there's even more that are no sleep or a little sleep, right? I think that's a big pool of people that do an appliance every couple months, and it's sort of there. It's intriguing. They would love to do more, but it's scary, and I like to. We always say the time. It's never a better time than now, but it truly is. Like what if we look back to when you made this switch or when you started in sleep, what's different now? What advantages does a general dentist have now that didn't exist when you jumped into this years ago?
Well, I think, general dentists may not be that aware of the changes that have happened in sleep, but as far as what you can do as a general dentist, I mean, more and more states are allowing you to send home HSTs with your patients. I know there are some states that don't allow that. The HSTs have gotten smaller. Many fewer polysomnograms are being done now. Well, when I first got into it, it was 90% in-lab studies, and now it's probably 98% HSTs. So the technology has come so far that they're just basically rings now, and it's just patients love them a lot more now. We know a lot more rules with insurance. The out-of-network stuff is a little more difficult than it was back then. We could bill out-of-network, but now more and more dentists are getting in-network, and so it's kind of essential that you get in-network. So we've kind of learned how to navigate that landscape. And then appliance companies have, the more competition there is out. I love competition. And when we get good competition, the prices start coming down on some of these appliances because they're competing with each other. It's I won't liken it to tariffs, but it's fun to see competition like this.
Mhm. No, definitely. And I think, the point you made about PSGs and HSTs, I mean, that's huge, right? Because
Yeah.
back when I started this, that used to be a big thing is people would tell me, look, John, I want to do more of it, But I told 100 patients to go for a sleep study at the lab, and of those 100, only 30 actually went, and it took 6 months for them to do it. And of those 30, 29 of them got put on CPAP, and I'm left with nothing. So, opening the door with home sleep, and that's, if you don't know, Dr. Smith just said HSTs, that's home sleep testing. Um, so opening the door with home sleep tests and better technology around that, but also telehealth has been a huge thing too.
Oh yeah, I didn't even think about that. Yeah,
That
COVID started
barrier to
that.
entry and that face-to-face requirement, that's telehealth has, I think, made a huge difference. And we didn't have that back in the day. It was harder.
No,
Uh,
we even do telehealth deliveries now. I mean, it's amazing how many functions you can use. Telesleep, telehealth, Zoom, Teams. We have all kinds of different ways to communicate with patients. But yeah, that's taken over how we, at least, I mean, in our practice, it's probably a little different than many because for the initial visit, we make sure they're in the office. But the very next visit is going to be telehealth. We go over the study, and that I think is the future. That's where I think it needs to be now.
Definitely. Um, you know, Again, kind of looking at those new dentists, or the dentists that are watching this, that are, they've done 4 or 5 appliances over the past year. They would love to do more. When I meet with them and talk to them, I swear it's the same concerns every single time. Like, what's holding you back? Where's your, what are your concerns? Number one, everybody's scared about insurance billing. They tried it and it probably didn't work well.
Yeah.
Or they just heard it's really difficult, or they heard, like you said, being in network is kind of becoming a more necessary thing. But I always hear concerns about that. I always hear concerns too about, gosh, I don't know if I want to do it because I'm afraid I'm going to change people's bites or move teeth. And
Uh,
speak to those concerns, because you've done a few tens of thousands of appliances now, so I could say that,
yeah.
if there was a big, huge black hole to fall into, it would have happened by now. So
Yeah, we just don't see the concerns about bite changes that people get scared of. Yeah, you're going to have some. It's going to happen, but it's all about communication. If you let your patient know, I mean, essentially what we do is place the onus on the patient. They're the ones that wake up every morning with the way their bite is. If they choose to allow their bite to change, that's on them, not on us. We give them different ways to get their bite back in place. We say, every time you come in, we're going to check that. But ultimately, you're the one that decides if your bite changes or not and allows that to happen. So, as far as that's concerned, you should not worry about that. Just communicate with your patients effectively. In these decades I've been doing this and the tens of thousands of appliances we've done, I've never been sued. I've never had anybody get upset at me. They ask questions. The dentists get upset because they go in for a hygiene visit, and anyway, that's another story. But honestly, it is really hard to do dentistry and sleep at the same time. I get that. And John, I know that you've told offices they have to have a sleep champ. They have to separate these practices and have somebody in the office that only does sleep, does not know how to do hygiene or assist or anything else. They're just on the sleep side. And then once you start getting a full column, at that point, you can probably start transitioning out of dentistry. I think we had 2 columns before I just handed over all my dental, but you can do it sooner than that. But anyway, I think having that sleep only person in your office to help run the program is probably the most important thing. Working with a company, either getting in network yourself or working with a company that is in network that can help you bill is important. And then as far as referral sources, I can tell you that I hear this story over and over again. Not until I became sleep only did physicians start referring to me. They love the fact that I'm sleep only. So it'll be easier to get those referral sources once you become sleep only. But it's a journey. It can't happen overnight. But if that's your goal and you work every day to get to your goal, you'll get there.
yeah. And it's funny you talk about referral sources, because it really does connect too with the medical billing aspect of it. And I
Yeah.
saw this data, and gosh, I can't remember at what meeting it was. This was a few years ago, but one of the dental sleep companies had surveyed a bunch of referring physicians, and specifically asking them about reasons why you would be hesitant to refer for an oral
That was
appliance.
ResMed that did that.
And
Yeah.
and I just remember the top, and they gave them all the reasons, the dentist credentials and the device that they use, and whether or not the appliance even works. All those were further down on the list. The number one thing on the list was the dentist being in network with insurance. It was like 87% or something. They picked like the top
Yeah,
thing.
and you wouldn't believe how many physicians didn't even know that medical insurance covers these appliances. They just didn't know. So they assumed the dentist couldn't bill in network.
Yep. And I thought that was remarkable, that that was more important to them than the efficacy of the therapy even,
Yep. Yep.
which is shocking. But I guess that's the medical model.
Yeah.
And that kind of bleeds into a perfect thing I wanted to hit on today. And you've got your AppsMe shirt on. Sorry, I see half the logo there, so that's
Yeah,
good.
there it is.
So this I get more questions about what is AppsMe and
I know. I
how do
do
you
too.
pronounce AppsMe. um, but the AppsMe is something that really came. I remember yourself and Ronnie and I sitting down at ASBA in Scottsdale like years and years ago, talking about this concept of what it is, what we should do with it, and things are kind of taking off now. So for those of us that don't know, what is AppsMe,
Yeah.
and yeah, what are we doing in DSM? Why is it a necessary thing right now?
Well, first of all, you can't use that's not an acronym. Okay. Don't try to figure out what all the letters mean. We just wanted a Z in the middle of it, and
Right.
that URL was available. So
Yep. It
we
was a
can,
it was a 5-letter domain name that was available, and it
right,
had a Z
right.
in it, and it
Yeah.
made sense. Yep.
But yeah, AppsMe is the way you say it. Yeah. But it's we're a management organization right now. We're designed to help sleep practices grow because there's lots of, and I've talked to so many that used to do sleep, but they stopped doing it because of medical billing, because of referrals, because dentistry got in the way, all those kind of things. So we're here to teach offices every step that they need, help them along the way with not only helping you get referral sources, whether it's through the VA or just marketing for these practices, but also helping them with the billing, make sure they get in network billing, helping them with verbal skills because that's huge when you're talking to patients. When if you're trying to sell them a $3,500 appliance, which I don't suggest. I suggest if you have a cash fee that it's less than that, but it takes some good verbal skills to be able to convince somebody to buy this piece of plastic for $3,500. So there's a lot that goes into it. Sleep is not an easy field to get into, but it's well worth it if you put the work into it. And I tell dentists all the time, remember how much it took for you to grow your dental practice? It's the same thing for a sleep practice. It's not starting all over because you've learned how to talk to your patients. You know about teamwork, how important that is. There's a lot of stuff you don't have to reinvent, but sleep is in the medical world, and there are certainly other things that you have to learn and grow. It's just you have to be in a constant mindset. I'm going to grow this sleep practice every day. What can I do today to make this sleep practice better?
I think that's hugely important. It's not so you can't buy a shortcut or just snap
Nope.
your fingers and the sleep patients will magically fall from the heavens. But
Yeah.
there are best practices to follow. There are tips and tricks, and I think with AppsMe, that's one of the things is, we said, hey, this is not a huge industry. There are a handful of people that have really, really figured this out and are doing it on a level that most people aspire to. So I think that was really it is, hey, let's create that cookbook and that guidance, and it can be as much or as little as a practice needs. Um, in closing here, I always like to talk about what's new, what's exciting in DSM. you know, is there anything that you've heard about lately that people should hear about or should know about? I like to, you know, one of the things that we've been focused real heavy on is the VA. I think there's a tremendous opportunity there to help our veterans and really make an impact. The VA has embraced oral appliance therapy. It's kind of a tricky thing if you were to go about it on your own, but again, being part of a larger group makes things like that easier. Um, but I think the VA is really, you know, tremendous. We're getting a ton of VA patient referrals in some big markets now, which is fantastic. But is there anything else new and cool and exciting that you've seen coming down the line that everybody needs to hear about?
Well, there's some unexciting things,
Um,
these companies that are trying to get patients
right,
to take their own impressions at home. And uh, so, if you're listening to this and you have a patient come in that used one of these companies and they took impressions themselves and the appliance is hurting, it doesn't fit, they had no follow-up, it's not working, whatever. Can you please report it to us? Because we're going to be communicating with the AADSM and APSS and different organizations to let them know this is not something that should be allowed. But I don't want to speak negatively. That's it. That's the negative part, right? So, yeah, I mean, like I said, the technology is improving tremendously. And I think with AI coming along, we've interviewed about 20 different resources to help us with AI for answering the phones. We use uh, virtual assistants. We call them RAs because VA, we get confused with the VA. So we
right.
call them remote assistants
Remote
rather than
assistance.
virtual assistants. So anyway, we have about 10 of those from the Philippines. They are excellent workers and they're very inexpensive to use and they do a fantastic job doing what we want them to do. So I think honestly with AI and with these VARAs in other countries like the Philippines is the best one to use. Anyway, if you use those resources, your overhead can go down considerably in sleep. So
Mhm.
if you're worried about hiring a bunch of people, and yes, we have a bunch of people hired, but every time somebody leaves, we just replace them with a virtual assistant from the Philippines. So our overhead is going down. So I do see improvements there. I don't see reimbursements with medical insurance getting less. I think we have some hope of them even getting better.
Okay.
Certainly with the VA. Um, I think because of all of the marketing that's going on with Inspire and with these other companies, the awareness is out there. So people are more aware that they have a sleep problem. They've tried something, it doesn't work, and hopefully they'll be coming to their own dentist to try to get help. You just need to be prepared for that because they're going to come in asking if they haven't already been.
And I think that's a huge thing, right? There's patient awareness around sleep health and wellness. You know, and you're seeing all the new drugs get approved, you know, that are, you know, sleep related and you know, obviously weight loss, weight management related. And you know, but you're seeing, you know, patient awareness. We always say is at an all-time high, but it feels like it's at an all-time high even now,
It
more than
does.
more than it
Yeah.
was, which is great.
Yeah.
It's definitely trending in the right way, and you know, I'm seeing some really cool stuff with new technology. You know, we have the new AppsMe DX units, the home sleep tests that are just ultra easy. I mean, it's gone from, you know, home sleep testing used to be this big giant like, you know, boxy unit that sat on your nightstand and there was like 15 cords and cables and effer belts and straps and things that came off onto you. And now it's a watch and a little finger sensor or less. It's crazy rings. So we're seeing it, you know, super easy, Bluetooth to your phone. So the barrier to entry for patients has never been lower in terms of being able to figure out if you have a problem and you know, and then awareness
Well,
helps
yeah,
us.
with their wearables that they're wearing now, they're
Oh yeah.
becoming more concerned, and then they're understanding, oh man, yeah, I've got a problem. I better talk to somebody about this.
Yeah, definitely. Well, guys, you know, Dr. Smith, I really appreciate you hopping back on here. I know you have an incredibly busy schedule, so I appreciate your time hopping on and chatting. We'll definitely do it again. I think next time we'll have Ronnie on with us too, because the three of us go way back. Um, I'll leave it with this. If you are an existing dental sleep practice and you're looking to take that next step, and try to, you've hit those hurdles and those roadblocks along the way, or you're brand new to sleep and this is something you've been considering, you've done it a little, but want to do a lot more, we'd certainly love to help you kind of test drive this in your practice and see if it's something that you could really scale out. So there'll be links here below or whatever to click and learn more about that. But thank you very much, Dr. Smith, for hopping on. I appreciate your time, and we'll talk soon.
All right. Loved it. Thank you, John.